Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's up, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 329 of the Ask Dr. Angela podcast. Hopefully you all are safe from the snow. I know I've mentioned in this series of podcasts that I've been doing today that there is a lot of snow on the East Coast. This is actually my second snow day, and I'm shut up in my office doing all things brand related. I'm actually getting ready to go and pick up my puppy from obedience school within the next hour. His name is Snickers. He is a rescue from the Humane Society. We have had him since he was 10 weeks, and he is a joy. He is a pit mix, and just a lot of fun, a lot of work, but a lot of fun. I'm going to jump right into today's podcast, which is on hysterectomies. Hysterectomies can be open, they can be laparoscopic, they can be total, partial, vaginal. Here's to explaining what that all really means. So why do women have hysterectomies? Let's run a list. Fibroids. Fibroids are one of the most common reasons that I perform hysterectomies. Fibroids are benign proliferations of smooth muscle. They can cause the uterus to become really enlarged. I have seen fibroids range in size from like the size of a pea to the size of a watermelon. Common symptoms that are associated with fibroids include heavy periods, pressure, pain, sometimes bowel or bladder issues. Endometriosis. Endometriosis is another very common reason that hysterectomies are done. Endometriosis is a medical condition where the lining of the uterus, which is typically shed as your period every month, instead of being completely shed of your period, the lining of the uterus will be shot out through your fallopian tubes and can implant on various aspects of your pelvis, whether it's the cul-de-sac, your ovaries, and even in some very unsuspecting locations like the diaphragm, lungs, bowel, etc. The pathognomic symptom that's associated with endometriosis is cyclical painful periods. Adenomyosis is another very common reason for hysterectomies. Adenomyosis is like the first cousin to endometriosis. And what happens with adenomyosis is that same lining that I mentioned in endometriosis that gets shut out through the tubes and implants on various aspects of the pelvis, in adenomyosis, that lining actually invades the musculature of the uterus. So hence, uteruses will become enlarged. On ultrasound, uteruses might have a bulky appearance without any obvious cause. Women that have adenomyosis will complain of heavy, painful periods. And while changes that are associated with adenomyosis can be visualized on an MRI, adenomyosis is a pathological diagnosis, meaning that the final tissue reading will yield the diagnosis. Uterine prolapse is another reason hysterectomies are often performed. Prolapse is often described by women as, having the sensation of something falling out of their vagina or feeling a bulge down there. Keep in mind, prolapse doesn't kill you, but it can sometimes cause issues with bowel and bladder, specifically incontinence or difficulty with bowel movements. Removing your uterus certainly will address this. Abnormal uterine bleeding, chronic pelvic pain, or other reasons women have hysterectomies. With regards to abnormal vaginal bleeding, there are typically more conservative ways to treat this, whether that be medical, hormonal, or other minor surgical procedures like ablations. A hysterectomy certainly provides definitive treatment for this. And chronic pelvic pain is a reason women will sometimes get hysterectomies as well. But it's really important to make sure that your chronic pelvic pain has been thoroughly worked up. And a hysterectomy should actually be an option of last resort for this because there are so many different entities for pelvic pain. You don't want to have a hysterectomy and not be 100% sure because you'll end up getting a hysterectomy and your pelvic pain will still be there. GYN cancer, whether it's cervical, endometrial, or ovarian cancer, is another obvious reason that women end up with hysterectomies. So With regards to hysterectomies, there are a lot of different types. Being a minimally invasive surgeon, which I am, I tend to do more minimally invasive surgery for hysterectomy. However, types of hysterectomies include abdominal, which is actually the most common approach. This incision usually is made in the same location as a C-section scar, which is 2 centimeters above your pubic symphysis. In cases of really large uteruses, a vertical incision can be considered. This is more like your mom's hysterectomy, meaning it's what's been done like way back in the days of old, but it's tried and true, and it's still a very popular option. If you happen to have an abdominal hysterectomy, typically you'll be in the hospital for 2 to 3 days for recovery, and sometimes longer, just depending on how your postoperative course is. Vaginal hysterectomy, LAVH or laparoscopic assisted vaginal hysterectomy, robotic assisted hysterectomies. These are all more minimally invasive approaches to hysterectomy. With regard to vaginal hysterectomy, the uterus is removed through an incision made in the vagina, so there are no abdominal incisions involved. This is, again, considered minimally invasive. And if you can find someone that does vaginal surgery, this is a really good option to consider. Laparoscopic assisted vaginal hysterectomy, while the uterus is still delivered through the vagina, the surgeon uses laparoscopic instruments through various ports that are strategically placed on your abdomen to take down, various ligaments and blood supply supporting the uterus. So this, again, is considered minimally invasive. And then we have robotic assisted hysterectomies. This procedure is pretty slick, and I do a lot of robotic surgery. Robotic hysterectomies allow the surgeon to perform the hysterectomy while sitting at a console that controls laparoscopic instruments placed in the patient's abdomen, similar to a laparoscopic assisted vaginal hysterectomy. The advanced technology associated with the robotic technology allows the surgeon from the console, which is usually on the other side of the room, to use natural wrist movements to control the laparoscopic instruments while viewing the surgery on a 3-dimensional screen. I'm a huge fan of robotic surgery. Most of the time, my patients that undergo the robot either go home the same day or the following day. Any type of minimally invasive surgery is going to have a lot of pros, meaning less blood loss, quicker recovery, less risk of wound infection. So there are a lot of pros to finding a GYN that does robotic assisted hysterectomies or any kind of minimally invasive surgery for hysterectomies. Radical hysterectomy. This is a big hysterectomy. This is the type of hysterectomy that's usually done where cancer is involved. This type of hysterectomy is typically done by a GYN oncologist. With radical hysterectomies, not only is the uterus removed, but it's removed with wider margins, i.e. additional tissue on the sides of the uterus is taken out. The cervix, as well as a portion of the vagina, is also removed in radical hysterectomies. Radical hysterectomies also usually involve some sort of lymph node dissection. Now, the type of hysterectomy that you have performed will depend on a number of different factors, ranging from the indication, if there's any pathology involved, like i.e. is it cancer? Patient preference does play a role. Your surgeon's experience, i.e. are you seeing a surgeon that has experience with minimally invasive surgery? Patient qualifications. Remember, not all patients are candidates for minimally invasive surgery. That could be due to having a history of previous surgeries and ensuing scar tissue or adhesions, if your uterus is very large, etc. The type of hysterectomy that you have performed will also determine the length of your hospital stay. Remember, open procedures like abdominal hysterectomies often involve a 2 to 3 day hospital stay. More minimally invasive procedures like robotic, laparoscopic, or vaginal may involve either an overnight stay or sometime I discharge patients on the day of surgery, depending on how their postoperative course goes. With any surgery, whether it's major or minor, there are always going to be risks involved. The more obvious risks include bleeding, injury to neighboring organs like bowel, bladder, rectum, etc., risk of transfusion. If the case is a minimally invasive case, there's always the risk of converting to an open case. There's also risk of infection, urinary incontinence, and chronic pelvic pain. I hope that this has given you some insight into hysterectomies, indications, types. If you have any further questions, please reach out. You can reach me at my website, www.askdrangela.com. Please check out my website. It's new, it's improved. You can sign up for the blog post, which comes out weekly. You can sign up for my podcast. You can also sign up for my YouTube channel. There is always a blog post as well as a video that's associated with the podcast topic. Those topics usually go hand in hand. Let's leave you with something from one of my favorite books, another one of my favorite books, Life's Little Instruction Book. Lesson 221 says, don't major in minor things. I'm going to say that again. Don't major in minor things. I am so happy to be back. I can't even explain it to you. So until next time, choose happiness. I cannot wait to reconnect on episode 330 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.